So here's a couple of good x-rays that are excellent for teaching. The first here is the fat pad sign. So these are both lateral radiographs. You can tell this is a kid because you can see the unfused distal humerus here. And what the posterior fat pad is essentially is displacement of the fat pad by a joint effusion, right? So there's bleeding inside the joint here that we can't see on this x-ray, but we see displacement of the fat pad posteriorly, which is pathologic and indicates a joint effusion. You also see it marked here on the front, so the anterior fat pad is displaced as well. So they'll call that a sail sign, like the sail of a boat. And this suggests an occult fracture in this child that's just not seen on this x-ray. In an adult, if this was an adult, the posterior fat pad sign specifically suggests a radial head fracture. In kids, it's almost always a supracondylar fracture. Over here on the right side, you see another lateral view of a pediatric x-ray, and you see this red line going through across the anterior humerus into the capitellum. So this is called the anterior humeral line, and it should pass through the middle third of the capitellum here. If it does not, if it's too far posterior or anterior, this would also suggest a occult injury to the elbow.